Many people habitually grind and clench their teeth, even while sleeping. They may not even realize they're doing it. This tooth grinding, called bruxism, can have debilitating effects. The constant heavy forces of the jaw movement can cause teeth to wear away, flatten, crack, or chip. In extreme cases, you may lose a tooth altogether. Severe bruxing can even damage dental restorations, causing crowns or fillings to wear down or break. If the wear exposes the tooth's inner layer, called dentin, you could develop painful sensitivity to hot, cold, or sweet foods. Bruxism can also damage the jaw joints or cause painful muscle symptoms. This condition is called temporomandibular disorder. Symptoms can be severe and include a constant dull headache, generalized facial pain, earaches, and jaw pain. Sometimes bruxism can be painless, and you may only notice that your teeth are wearing and chipping. Though all of the causes aren't yet known, bruxism could be a symptom of teeth or jaws being out of alignment. Missing or crooked teeth could also be factors. We'll do a thorough evaluation and discuss the best options for you. To ease bruxing while you sleep, we may recommend a night guard. Some cushion a full arch of teeth, while others fit just your front teeth to prevent clenching. Stress might also contribute to bruxism. We may recommend stress reduction techniques such as counseling sessions, nutritional guidance, exercise, massage therapy, or medication. If left untreated, bruxism can lead to depression, eating disorders, headaches, and increased damage to teeth and jaw joints. It's important to treat bruxism early so you'll have a better chance of keeping your smile for a lifetime.